we need to use the existing literature, and that's what we do in our program to build our assessments and treatments, but also to develop new ways of treating these problems in less structured environments. So my take home was typically in our program, we don't do traditional functional analyses. We feel that we have enough information. We know now that in part these inappropriate behaviors are maintained by negative reinforcement in the form of escape. So my whole program now is built on what antecedent variables do we need to manipulate and how do we come up with a starting point for treatment. If we have the right starting point for treatment, then we may be able to keep emotional responding down and potentially keep some of the inappropriate behaviors down. So we're doing a lot of research in our program figuring out, does it matter to start with specific foods when we start treatment, like specific bite size? I mean, there's a variety of different antecedent conditions that we need to evaluate to determine what the starting point is. I think for me, I want us to keep talking about starting points. And for children with autism, I mean, I had so many people after the talk come talk to me. You know, they work in ABA companies and they're faced with having to work with children with feeding problems where they don't have the expertise to do that. And so they're asking me, what should I do? And my first advice is, if you don't feel comfortable, which you shouldn't, you should not be treating problems that are out of your scope. And so I said, you need further training, or your company needs to reach out to other people who are experts, because that is the very problem that we're facing. And it's really not the BCBA's fault either. You know, they are asked to treat these problems that they don't have training for.